we completed bronchodilators. Now in this video we will start cough and the drugs which are used to treat the same. Cough is the reflex protective mechanism that is initiated by both apparent and apparent pathway from respiratory system to the cough center that is present in the medulla oblongata, in which if the mechanism is become uncontrolled, thereby results in the discomfort to the animal, thereby results in the treatment required. And the cough is classified as dry cough and moist cough. Dry cough, in which cough without enhancement of mucous secretion is there, and in moist cough, cough with enhancement of mucous secretion is there. Now let us classify the drugs which are used to treat the cough. Antitussives are the drugs which are used to treat cough, to be specific, dry cough. These are classified as peripherally acting antitussives, centrally acting, both centrally and peripherally acting. In peripherally acting, these drugs are again classified as demulcents, mucosal anesthetics, bronchodilators, and expectorants. Examples for the demulcents are honey, syrup, and glycerin. And these are act by coating, protect, and soothing mechanism to the respiratory lining. And the examples for the mucosal anesthetics are benzonatate, and the mechanism of action for the same we will discuss later. And the bronchodilators examples such as ephedrine, theophylline, and isoprenaline. And the mechanism of these bronchodilators we already discussed in our previous video. And examples for the expectorants are bromhexine and water aerosol. Let us come to the centrally acting antitussives. These are again classified as opioid antitussives and non-opioid antitussives. Examples for the opioid antitussives are codeine and hydrocodone, and these are the potent inhibitor of the medullary cuff center. These will inhibit the medullary cuff center. And examples for the non-opioid are dextromethorphan or falcodine. Now let us come to the final classification of the antitussives, that is, the drugs are antitussives which act both peripherally and centrally. Examples for this is benzonatate, and benzonatate is also classified as mucosal anesthetics. And the mechanism of action for the benzonatate is these drugs which act by depressing the afferent sensory impulse of cough reflex, and the benzonatate will desensitize the pulmonary stretch receptor, thereby there is no cough. Or the benzonatate will inhibit the afferent sensory impulse to the cough center. Now let us come to the expectorants. These drugs are used to treat moist cough, and these are classified as mucolytic expectorants and mucokinetic expectorants. Examples for the mucolytic expectorants are bromhexine and acetylcysteine. The word mucolytic itself suggests that these drugs act by the breaking of sulfur bond and sulfahydryl bond of the glycoproteins of mucus. Thereby, these drugs will decrease the strength of mucin and decrease the viscosity. That will eventually lead to the sputum expulsion and irritant get diluted. Now let us come to the mucokinetic expectorants. These are again classified as secretory expectorants and direct acting and mixed acting expectorants. In secretory expectorants, These are acted by the reflex acting secretory expectorants. These drugs will try to increase the secretion and get rid of the cough. And for examples of these secretory expectorants are essential oil of eucalyptus and balsam of tulip. And direct acting mucokinetic expectorants are guaifenesin, and this will directly increase the bronchial secretion and mucosal ciliary action. Thereby, it will help in the getting rid of the moist cough. And the last one is mixed acting expectorants. These act both directly and secretory expectorants. In the mixed acting expectorants, examples are potassium iodide, calcium iodide, and ammonium chloride. This is about the cough, antitussives, and expectorants. Thank you.